Hi, everybody. Thank you for having me. First of all, I work for the Leukemia Lymphoma Society, so every time I address multiple myeloma patients, I like to start by saying it's not in our name, but it is one of the diseases we cover, and we have a lot of resources and support for you, because people always want to know why it's not in our name. I'm the Florida guy. I don't cover that. So if you call our CEO, but and the marketing people, but that's not anything I have anything to do with. But we do have a lot of support and resources for multiple myeloma patients. So I just want to kind of put that out there to start with. So I've been asked to talk about patient assistance programs, and I have a list of them, of very specific ones, not just the general list that's in your packets of what's available today that is open. I consulted with one of our specialists who works on that to make sure I had a current list for you. I will tell you it can change tomorrow, that it does change all the time, but I want to kind of give a little what I call social work advice around patient assistance programs. A lot of people don't take patient assistance programs because they feel like right now they're financially okay. And a lot of times they continue to be okay, but sometimes patients and families come back to us 5-10 years later, again, this is a marathon, and say, now I need help, and they need more money than is available at that particular time or moment. And what I feel and tell people is, when they're newly diagnosed, if you qualify, take the money. You can always give money in a different way later back to a great organization that helps multiple myeloma patients, or leave it for your family if they need it because they were a great support to you. But if you don't take the money when you qualify for it, you may not qualify for it, or it may not be available later. And so that's something that's just really important to note. And most of the financial assistance programs, they're not necessarily for quote unquote poor people. They're for people who are working, or people who have money in savings and are retired and have an income. They typically are 400 or 500% of the U.S. poverty level, and because the LS programs are 500%, I can tell you what that means is a family of 4 can make about $125,000 a year and still qualify. So it's a significant amount of money. And depending on the program, some of them do look at assets that you have, but some of them just look at income. They don't look at assets. So if you're retired and now your retirement income is lower than it was when you were working, or you retired early because of your multiple myeloma, there's an opportunity there that you could potentially qualify for financial assistance from one of the organizations. And so again, my suggestion is, again, if you qualify for it, take it. It's really helpful, and you can always do something fun with the money you have in the bank later, or do something charitable with it, or whatever it is that's your choice. But at least it gives you that choice at that time when you have that. So I feel that that's something that's really important. So I'm going to give you the list of the multiple myeloma foundations that have funding as of today. What I would say that as multiple myeloma patients, there's a lot of funding available. We do these talks for other diseases. Great as they are, the amounts of money are not always as great as they are for multiple myeloma patients. So first is the HealthWell Foundation, but you have to be on Medicare. But they provide $10,000 a year of assistance. And they also use that 500% of the U.S. poverty later. The HealthWell Foundation. And they're on your list. So if you want to just circle them on the list to know which ones that are there. In addition, Cancer Care has money for multiple myeloma patients, but you have to be on a federal health plan or on Medicare, again, for that one as well. So Cancer Care. And that one is also $10,000, but that one is the one that had the 400%. The Patient Advocate Foundation has assistance available, and they have both for patients with Medicare, Medicaid, or military insurance specifically. And then the Good Days Foundation, and I don't know if that one's on, oh, it's on the list, yeah. That's part that is the, used to be the Chronic Disease Fund. They have travel assistance money right now. So they don't have financial assistance specifically for treatment, but they have financial assistance for travel. So if you're traveling for treatment, or you live a distance away, or you're coming to Moffitt for a transplant, there's an opportunity there to have that, or you travel for treatment. And it depends on how much the expenses are, some of the different foundations. So, you'll have to look and read the guidelines very carefully. And then sort of last but not least is the Leukemia and Lymphoma Society has financial assistance available right now. And we have copay assistance, again, in the amount of $10,000. And that one you can have commercial insurance. So if you're still working or you aren't eligible for Medicare for some reason, you might want to consider that. Also with the Health Wealth Foundation and LLS, we help cover premiums of insurance. And so something that's important with that is maybe you weren't sure if you should elect the most expensive, or I don't want to say most expensive, but the one with the most coverage for a Medicare supplement. And that is something that those will cover, so that if you have a high out-of-pocket, but you get a supplement that may cover and reduce that out-of-pocket expense. So think about that when you're doing that. That's particularly helpful for people who are just going on Medicare, because that's the time when you can really take a more rigorous plan and have a choice of supplements. Sometimes if you have a diagnosis already and you're already on Medicare and in a supplement, it's hard to change. But when you're just first going on it, it's a lot easier to do. And then the LLS program covers that, and also treatment-related expenses, which is what HealthWell does as well. So treatment is the drugs or getting an infusion in the hospital. It's not necessarily seeing one of these great doctors up here or getting the scans or tests that they order. And so that's something that's important. But you also have the premium money in your pocket to go forward with. And one of the things sometimes that is helpful is to plan with your doctor, if money is an issue for you, about how you're going to work out what needs to be done. So in December, it may be a time to get your scans when you're at the end of your year and you're ready to hit your out-of-pocket or other testing done. And then if you're going to need treatment and you know that you can get copay assistance for that to help get you through that treatment portion, maybe January is a time to start it after the holidays so that you're ready to do that. Sometimes you have those choices, sometimes you don't, but it's at least a discussion you should feel comfortable having with your doctor and let them know about your situation. And if they have a social worker or a financial counselor in their office, sometimes they can help you and know as well and be able to assist with that as well. And then we also currently have our travel assistance program open. And again, it's 500% of the U.S. poverty level. And for LLS, that's a $500 debit card. You can use it for gas, you can use it for car rentals, you can use it for airfare, and you can use it for hotel. So even if you have a financial issue and you're not traveling a great distance, $500 worth of gas in your car is a lot of money. So to be aware of that as well. And so, just kind of summarize, I think it's really important to remember that when you're doing these things, you should take what's available to you. And there's a whole list of foundations and resources here in your booklet. And just know that if they didn't have money open today, they might have money open sometime in the future. And I will tell you that the Leukemia and Lymphoma Society, as well as other organizations, do have lines with resource specialists who can tell you what's open. So I didn't go research all these today. I sent an email to our information specialists, and they said, "Oh, Seth, great, you're doing a talk. Here's the things that are open today." So they knew it, and they didn't have to go run around and look at it. They knew where to find it, and they keep lists of those, and they communicate with each other on a regular basis what's open. So you don't have to take the time to do that either. You can pick up the phone and call us and get that information as well. The other thing that I think is really important when we talk about patient assistance and support is going to a support group, and IMF has great support groups, LLS has great support groups, there are support groups in the community, and talking to others and see where they got help. Because sometimes you'll find out about a foundation or a local foundation, something just in your community that might be able to help you with assistance. Florida Cancer Specialist has a great foundation that helps with cost of living expenses that sometimes can help people. So it just depends on where you live. In the Jacksonville area, Cancer Specialist in North Florida has a local foundation. So there are different local foundations as well, depending on where you live, that may be specific. And you can get help and find out about those in your community. So that's it for me. Thank you very much.